now is just some of the videos from March Disability Awareness Month for the activities that we actually got to have.
Yeah.
So the 12 pictures we have for the whole month, we're playing those for you.
And just so everyone is aware, IT has begun recording the video, so we'll have it on record.
Okay, great.
Give that disclaimer out there that it is being recorded.
Speakers are muted. Oh, great. Oh.
Ross, you might have to just scoot those things along.
There's no charge on it. Yeah, I was thinking. I guess I could keep it.
There was a couple people on the list that weren't in, and it looks like they hopped out. I'm not sure if they had something else come up, but I will make sure anyone who comes in the lobby, we make sure we get them in.
Well, we can go ahead and get started. I appreciate all of you brave enough to put your face on after 5:30 on after a long day. Wanted to just thank everybody for being here. And we're going to try and stay somewhat on task because we have some special guests that are going to join us this evening for our meeting, which I'm pretty excited about. One of those being Dr. Indy Lane, our new Chief Medical Officer of the Fishers Health Department. And a real treat for me, I can say, because I hardly ever can get these two in the same room. Both Kylie Hope, the Director of Division of Disability and Rehabilitative Services for the state of Indiana, and her Associate Director, Kim Upsall, who is a Fishers resident, will be joining us as well to talk a little bit about just what's going on as far as a service perspective for folks who get services and for intellectual disabilities throughout the state of Indiana. So first off, though, we're going to recap what we were able to accomplish in March with Disability Awareness Month. And Cecilia, you can take it away.
Yes, great. Well, thank you again, everybody. Kelly and I appreciate your time and that we're all gathered again. I can't believe, I feel like March was yesterday and now all of a sudden it's like June. And I don't know, it's gone by so fast, but at the same time, it feels like an eternity. And I just hope everybody is doing well and is safe and healthy and hopefully getting back into a good routine. But so we were off to a great start. March Disability Awareness Month started off awesome. We had a kickoff at City Hall, and our theme this year was Focus 2020. We were focusing on the past, present, and future, highlighting the things that Fishers has done from the very beginning up to the current time now. We were also highlighting the anniversary, the 25th anniversary of the ADA. So we ran a video about the history. Kelly gave a presentation kind of highlighting kind of where things are from where we were when people were being institutionalized up until now, where we have ADA laws and what Fishers is doing. We had 3 speakers at our kickoff event. We had Todd Root, Wilbur Sutton, and Ellen Sutton, and Marie Kennedy. And what we featured this year were 3 caregivers, three families, 3 caregivers to share their perspectives of how things are going for them in Fishers, and what are some of the highlights that have been really great things that Fishers has done, specifically the Fishers Advisory Committee on Disability, to help champion those with physical and intellectual disabilities in our community. So it was very well received. We had a packed house. I think it was one of the most crowded kickoffs that we had. We also gave out some awards to some of our stakeholders in our community, like Aaliyah McGrath, our deputy mayor, former deputy mayor. She won an award for her advocacy in bringing more awareness to disabilities and the things that she's been doing to help advocate for us in the community. Brews, Books and Brews, a business in Noblesville, won an award for what they're doing for employing people with disabilities. And Noah Malone won an award as well for being a person with a disability who's gone above and beyond as a role model, as someone who's been an awesome advocate and example of what they can do given the opportunities in our community. So we were really excited about that. We also had our quarterly Fishers Advisory Committee on Disability quarterly meeting, and we focused on our caregivers. We really thought that we needed to share some perspective and provide some guidance and support for our caregivers. It is a very challenging role at times to be a parent of a child with a disability, or to be a grandparent or a direct service provider. So we provided some presentations on stress management, how to overcome anxiety, what to do when you're feeling stressed out, coping mechanisms, mindfulness. So that was really interesting and informative. We had the EMS, our Fishers EMS personnel, come and share what they're doing with regard to behaviors that might occur when they're out in runs, how they're handling working with individuals with disabilities here in our community of Fishers. We also gave some giveaways, which was really nice. We had a raffle. We had the community provide gift cards, merchandise. It was really nice just to provide some little giveaways to the caregivers that came. We also featured the meeting over video, so people could see the meeting over video, and they could also download it or watch it later at their convenience from their home. So that was one of the first meetings we've done that. We were able to do our celebration of inclusion of the art through the arts at Conner Prairie, and that was a huge success. We had a lot of people there, and it was really, really nice to see the artwork there. We had the artwork at City Hall, and we also had like over 20 businesses that provided artwork in their individual businesses throughout the city. So that was just spectacular to highlight the talents and contributions of our artists here locally. And we want to thank the Fishers Arts Council. Tom Rich put a lot of time into this, and he did an amazing job. And Conner Prairie, as always, was a gracious host, and their board got to see some of the things that the Fishers Advisory Committee on Disability is doing, and they were very impressed, and they want to continue to work with us as a partner in helping to provide a really wonderful experience for people with physical and intellectual disabilities there at Conner Prairie. So we were really fortunate about that. we did have an event. It was a fundraiser that Scott Long did over at Grace Church, and it was a wonderful event, and it raised money for the local Best Buddies programs and the unified sports teams here at Fishers High School and Hamilton Southeastern High School. So that was just awesome. So we were able to get that done. And the last event that we were able to do was the looking at employment differently, where we brought in individuals to come and share their experiences working in the community and how employers can look at how they can have a diverse workforce. How can they look at employing people with disabilities who are willing and able and capable of being wonderful employees and are able to really do amazing things given the opportunity. So we were able to get those events in, and unfortunately we had to cancel all the other ones that we had planned. And so hopefully as we open up again, we can look at probably bringing some of those events that weren't able to be brought in March and table it for next year for March, and also look at maybe doing our reverse job fair maybe later sometime in October. So that's something that we can look forward to. So, but it was a great month. The YMCA too had also partnered with us in providing free passes to the Y for our caregivers, and unfortunately with the closing of the due to the virus, that was a little bit of a hiccup, but we really appreciate all of the support from the YMCA, and they were awesome. So Kelly, can you think of anything else that I might have missed?
Just that we might potentially look at rescheduling the reverse job fair. That was something people were pretty excited about, that we might try and find. Again, I don't think anybody really knows what's going to happen in the fall, but maybe potentially looking at that for the fall. And then I just expect that 2021 will be the best ever, because we'll have some opportunity to really make it awesome.
Cecilia, this is Stacy. I don't know if you can hear me, but just wanted to ask about the event that was scheduled for June Lee, that facility, the performance event. I don't know if that was mentioned.
No, we were not able to do that event, the talent show. We did not have that. June Lee did do an event. It was a silent movie. And so that was an event that they did, and I believe that did go through. It was kind of something that they decided to do in correlation with March, but it was done in February. But the talent show, if that's what you're referring to, unfortunately, we weren't able to make that happen.
Thank you.
Mm-hmm.
So I think that's a wrap on March Disability Awareness Month. Now, for those of you who have tuned in specifically to get into the meat of a lot of things that have to do with our Fishers Health Department and moving forward from where we've come in COVID-19, we're going to pack a lot of information into the rest of this meeting. So if you have questions, or if you would like to speak, you'll see a little bar that has some icons right underneath the screen or the PowerPoint presentation. One, you can raise your hand by clicking on the little hand, or you can also use the little chat icon if you would like to ask a question, and we will try to answer all of those. We have some other questions that came through the SurveyMonkey as well. But right now, what we're going to do is introduce to you for the first time the Fishers Health Department, which is just doing some great things already. And we'll have a number of resources on the next slide after we show a video and interact some with Dr. Lane. But at this point, we're going to just show you the video that helps introduce the Fishers Health Department.
Hi this is Mayor Scott Fattis. I'm here today to talk to you about the logical next step in our progression towards creating a healthy community. For some time, the city of Fishers has pursued innovative ideas like our mental health initiative and community paramedicine. The next logical step for our community, particularly in regards to I'm excited to introduce our medical director, Dr. Indy Lane.
Hi, I'm Dr. Indy Lane, your Fishers Health Department Chief Medical Officer. It is my job to ensure that the Fishers Health Department serves the residents of Fishers to ensure the health and wellness of our community. We've built a public health department that will serve the residents of this community effectively, efficiently, and with the overall wellness of our residents in mind. And during this global pandemic, we know it's more important than ever that we have information about what is happening within our community. COVID-19 has created an unprecedented need for clear and transparent public health data. As the Chief Medical Officer for the Fishers Health Department, I can assure you that we have been diligent about bringing multiple sources of information, fact-checking, and ensuring we're providing you with a statistically accurate view of the novel coronavirus in Fishers. Today, I want to share with you a new real-time dashboard we've developed and published on the Fishers Health Department website for you to access at any time. You can access the dashboard by visiting either fishersrecovery.com or fishers.in.us/health department. Once there, you'll find the real-time data we are using to assess the current COVID-19 situation in Fishers. By hosting our own testing site, we have the ability to understand more context around those seeking testing. This data shows just that. We've been able to incorporate the assessment results of over 4,000 residents alongside demographic information, symptom disposition, and more. It's my hope this additional information allows you to feel even further informed to make the right decisions for you and your loved ones as we begin to move to recovery. While the numbers we're sharing with you today show that Fishers is faring well in the fight against COVID-19, we believe it's because you have taken this threat seriously. Fishers was one of the first cities in Indiana to enact a travel advisory to encourage people to stay at home and reduce unnecessary trips in public. Your cooperation in that act has undoubtedly helped to put us in the position we see today. So in closing, I ask that you remain vigilant to ensure we keep these numbers low. Continue to maintain social distancing. Wear a mask when in public or when social distancing isn't possible. If you're able, continue to work from home. Maintain a healthy lifestyle through exercise and proper diet. Continue to stay informed of what's happening in our community to make the right decisions that make sense for you and your loved ones. With those simple steps, we can make an impact on the spread of coronavirus in our city. I am proud to serve the Fishers community, one that I call home. Stay healthy and stay safe. Thank you.
I don't know if you guys can hear me or not.
Yes.
Oh, yay. Okay. Hi, Dr. Lane. Thank you for joining us.
Hi, just call me Indy.
Well, Indy, I was noticing that you have your hair up. I was like,
I do. Listen, the hair down is for only special people. It's a lot of hair to get straight.
oh, I'm sure. Well, we're super excited to meet you, even though it's virtually, and have you a part of our group this evening. As I shared via email, you can talk about whatever you want. But I know two areas that I think would be helpful for this group to hear is, how people in Fishers who have unique challenges and disabilities, how do you see them most benefiting from the work of the health department? And then, of course, what advice do you have for those who are really our most vulnerable residents and their caregivers as we begin commingling socially again? Because I know there's a lot of fear that surrounds that, and you get to be our expert. So tell us all about it.
Right. Well, I always say it's nice to be an expert on something that's novel because it's changing so frequently that there isn't a precedent. But what we do know so far is this, just by virtue of being what we would consider disabled, does not increase your risk of COVID. It is the other comorbidities that we know impact people regardless of their mobility, such as respiratory diseases, underlying respiratory disease, or underlying cardiac disease, or being immunocompromised. So if I am a Fishers resident and I need help because I'm a quadriplegic or a paraplegic, that alone doesn't make me at increased risk. Now, the fact that I'm going to need a support person that's going to be in very close proximity with me to help me with bathing or with, getting in and out of a chair or ambulation, that increases the risk of COVID transmission. So I think that that's important for, residents to understand that we're concerned about whatever other underlying health conditions a person may have, and they need to stay on top of that. So if I have a disability because I have MS and I'm immunocompromised based on that and the medications that I take, then I want to be super cautious when I'm interacting with family members or my support person. That support person should always wear a mask. I should wear a mask as the individual receiving care, and then obviously be good about hand washing. If you have a support person, there are going to be instances where they can't social distance, right? So I think that that's where that hand hygiene and the mask is so critical for those individuals. So I think that, again, whatever comorbidities you have to be sensitive to those as you think about going out in public. There was an article that was published last week in The Lancet that talked about the importance of social distancing. So wearing a mask is important, but they noted in the study that social distancing was a little bit more important than even wearing a mask. So that transmission of respiratory droplets when you are in close proximity with another person increases your risk of transmission. So when a person with a disability is out in public, maintaining that safe social distance, particularly as, some places I go, there are lots of people wearing masks, and other places not so much. So even if as an individual I'm wearing a mask, if someone else is not, it's important that they try their best to keep a safe distance from others. And that would include, healthy, presumably healthy family contacts as well. They should maintain a safe distance and also wear a mask whenever they're around, a person that may be disabled or have comorbidities that put them at risk. I think that one of the things I worry about with all people during this time, but particularly people with disabilities, is depression and a sense of social isolation. And to me, almost as important as making sure they're staying healthy in terms of the comorbidities is making sure that from a mental health standpoint, whatever services, Fishers can provide from a mental health standpoint, that residents know to reach out for those, particularly those that are disabled, because maybe they can't get out as much as they should, or maybe they're fearful of being in contact with someone with COVID. And so that contributes to, a feeling of loneliness or anxiety or depression, because of that. So I think it's important that we are sensitive to those changes that may occur when people are isolated from their loved ones. Maybe it's not so much because I have a disability, but maybe I have a mother or a grandmother that I am accustomed to seeing, and because of their health, underlying health conditions, I'm not able to spend time with them. So I think that we have to be sensitive, to those needs as well. And as I mentioned before, I think whatever support persons that are in a home or a facility that are working with various individuals, making sure that they are assisting with keeping surfaces clean, that they are using frequent hand washing, that they're washing the hands of the individual if they're unable to do so, throughout the day, as well as wearing the appropriate PPE on their face, glove, mask, gloves, whatever is appropriate. As you heard on the video, I think that the website offers the assessment for support persons or Fishers residents that may be concerned about a contact with someone that might possibly have COVID. And I think that that's a resource that hopefully you will take advantage of, as it's free to Fishers residents, and then businesses can also utilize that service. I think the more people that we know, whether they're symptomatic or not, that have COVID, the better able we are to be able to track their contacts and make sure that those that are at highest risk for severe infection are being contacted and isolated and monitored for developing symptoms. So aside from that, are there any other questions that I can answer for you all?
I do have one question that, well, now I have two questions. The first question would be, I know that the back to school plan or the suggestions came out from Governor Holcomb's press conference last week, where we're starting to see recommendations at the state level on how people can safely return to school in the fall. Will we specifically follow that plan for Fishers, or will HSE schools work with you and the Fishers Health Department to kind of hone that in for specifically in our community?
Right, so it's my understanding that based on those recommendations, there are like, almost 8 different suggestions for the back to school plan. So we do have a meeting on the calendar to kind of go over each of those plans to see what makes the most sense. I think that they have to make a decision clearly, fairly soon. And so that will be a discussion that we will have with the superintendent, and hopefully do in a collective way that makes the most sense for, the health and well-being of the students.
Also, I know that on the Fishers Health Department website, there is some specific information about how citizens, people who live in Fishers, residents of Fishers, can go get tested. And there is a way that to be screened. Is it appropriate? And then you go do the drive-through testing site. Is it possible that someone could be tested twice if it was needed?
Yes. So there are, the system is set up so that you answer the questions, and if you've done the test once and then say tomorrow I want to do it again, I get a negative test, but I'm really anxious about potentially being exposed. Based on my responses to the questions, it will then push out my appointment based on the severity. So if I haven't had any symptoms, I haven't had any recent contact, the system is set up so that someone can't go through the drive-through every day.
Okay.
That was a concern.
I am certain that it was. One question, and this is just me being a data nerd. I watch things at a state level because of I'm a healthcare provider. I watch things at a local level because I care about Fishers and I live in this community. On the state coronavirus website, there are Hamilton County numbers. Are the Fishers numbers inclusive of the Hamilton County report?
So the Fishers numbers are not, it's a little dicey because we started testing on April 24th when the health department was up and running. Once we started that process, it became very difficult to get information from the state that was specific to Fishers because of the data reporting system that they have. They couldn't add us as a health department. So a lot of that information is being tracked manually because we can't verify it in real time. So the numbers don't always match up, and that's the challenge with the dashboard, is that we can't go in and you can have a zip code and you not really have a Fishers address, but you're part of the city of Fishers, and so it gets a little bit tricky. So that's been the struggle with putting some of the information specific to Fishers on the dashboard, is that we're not able to access the system. It's called the MBS, and apparently they have to shut down the system completely to add a new health department. And in the middle of a pandemic, they're not willing to do that. So we have had to, for lack of a better term, really kind of do things with paper and relying on people from the state to send us information and try to match it up. So it's been an arduous process that, fortunately I haven't been responsible for, but that's why the numbers don't match up.
Let's pretend like it's the last week of July. Would you foresee it being potentially advantageous and allowable that all of our school personnel would be tested prior to school opening back up?
All of it through Fishers, through the health department?
Yeah.
I think that, that's a good question. Should the teacher, I think, where do you draw the line? Do we test all the teachers? Do we test all of the environmental services or the janitorial staff? So I think that those are discussions that we've been having. I don't have the answer today. But, you know, who do we test? Do we only test those, you know, do we offer testing to symptomatic or high risk individuals? I don't have the answer today, but that is something that we're considering. I just can't say with any reliable certainty what direction we'll go in.
Great. Well, again, thank you so much for being with us today. It's a pleasure to see you and meet you and hear you. And I know from my own perspective, I'm pretty excited to see how our community fares against other communities in Hamilton County and where we are and the progress we're making as a community against the state as a whole. So thank you so much for being here. I think you've answered all of our questions. You're awesome. And certainly we will stay in touch with you as we move forward with the state part, with your Department of Health initiatives, but also our disability initiatives and how those can cross in the future. So thanks so much. Appreciate it. If we could all clap if we were on the same page.
Well,
a round of applause.
It was a pleasure, and certainly reach out to me. You can reach out via email. My cell phone is always an option. You know, all of this, the physicians that I work with, all of this is evolving. And so, you know, how things look today on June 9th, maybe not how they look in, you know, July 9th with all of the changes. So I think that, you know, staying in communication and understanding, you know, how this is evolving is important. You know, I just don't think we have all the answers right now, but I think we're working really hard. I am so appreciative to be a part of this new endeavor. I think that while we're learning a lot and there's a lot of answers that we don't have, I do think it's going to be good for the city of Fishers. I'm a Fishers resident too, and you know, I want what's best for this community. I can say that thankfully it seems as though the incidence in Fishers is low of COVID, which is good. And, you know, I think that what I'm learning is that is really important in terms of, you know, asymptomatic spread and that sort of thing. So everybody be safe, wash your hands a lot, and wear your masks when you're out in public. And like I said, do not hesitate to reach out to me. My email is ilane@ecommunity, E as in Edward, community.com. And my cell phone number, if you have a pen, is 317-371-3526. So just shoot me a text and say you want to talk, and you know, I'll give you a call back, or I'll answer your text message. So, you know, when I say reach out to me, do not hesitate to reach out to me either way, ilane@ecommunity.com or via my cell phone. But I appreciate the opportunity, and, you know, please reach out and let us know how we can serve this community better, how we can, you know, help you in any way.
Thank you, Dr. Lane. Very nice.
Thank you so much.
You too. You guys have a great day. Thanks.
Thank you. Bye-bye.
Bye-bye.
Ross, you can go to the next slide. So as Ross suggested at the beginning of the meeting, we are recording this, and Kelly has assured me that we are going to also post these slides as notes for the meeting, because there were some folks that couldn't make it tonight. But this is kind of a recap of some really important things that you can share with people, especially if you feel like what you heard tonight would be helpful for someone else to hear. I know we have a strong community of advocates and share a lot of information. The link to that real-time dashboard, if you haven't seen that, it's pretty cool. Lots of good data about our community specifically. So I put the link there for that. A link to how to get tested. Just a note, and we didn't talk about this with her, but Fishers is not administering antibody testing at this time. We are only doing testing for whether or not someone is positive. And so there is a pre-screening form. I've listed the link to that as well. So if you are needing to get tested, you can go through that pre-screening. And really, there's a lot more that the Fishers Health Department is existing to do, and that is looking at things like vital records, immunizations, food safety and permitting, monitoring and assuring that people are safe with their public swimming pools, things like mosquito and rodent control, and helping residents with private water wells and septic systems. So that's really all part of the Public Health Department. For our community, and obviously they're very busy with COVID right now, but all that information is available on the city website. And she was just delightful. So I was so happy to meet her. Ross, you can advance the slide. So hopefully they have found us. Kylie Hope is the director of the Division of Disability and Rehabilitative Services, and Kim Upsall is her associate director. Many of you may know that the division falls underneath one of the largest umbrellas in state government, which is Indiana Family and Social Services. If you have a family support waiver or a community integration and habilitation waiver, or you live in a group home, any kind of those services that we provide through the Bureau of Developmental Disabilities, Kylie and Kim are the ones that help run that program for the state of Indiana. I know personally, as someone who's involved on the daily with supporting folks who are in services, these guys have been amazing leaders and really just great mentors for many people as we've gotten through this pandemic. So I'm hoping that they're on here.
I'm on.
Kylie.
Hello.
And Kim.
I'm on.
Where are you at, Kim?
I'm at home.
Okay. There you go. Hey, and not that Kylie's not super special, but Kim is also a Fishers resident.
I was going to say
yes.
yes.
Excited to have Kim as part of this, not just as the associate director of the division, but to be a part of this as a Fishers resident. So I'm going to let you guys take it away. They often have plenty of things that they'd like to say. A couple areas that I asked them specifically to address were, kind of what positive things have they seen as leaders come out of this pandemic, because we can talk about the things that are scary and challenging, but at the end of the day, there have been some wonderful things that have happened. And really, how do they see this experience and the lessons we've learned changing the course of supports and really how we look at Hoosiers with disabilities differently from here on out. So you girls can just take it away.
Well, thanks, Kelly, and thank you all for having us. It's good to see some familiar faces and others that I may not necessarily know, but again, appreciate the opportunity and have always appreciated, I think, the community of Fishers, of their proactive nature of really identifying, serving individuals with disabilities just as being part of your community. And how do you do that? So again, kudos to many of you of leading that cause as well. So as Kelly said, yes, I am the director of the Division of Disability and Rehabilitative Services. I'll let Kim also introduce herself as well quickly. But sorry, we don't have any planned presentations, so Kim and I will just kind of banter back and forth if that's okay. And I'm definitely, for the time allowed just open discussion and provide any questions you may have as well. But to answer some questions, or the two questions Kelly proposed, it's been an interesting ride. No one really signs up in these roles to think that they're going to manage a pandemic at one point. And in some ways, it turns everything upside down, clearly, appropriately so, to ensure that we have the health and safety of individuals that we happen to support and families at the forefront of what we do. I joke because you don't typically hear me say that, because that is some ways the health and safety risk of wrapping people up in bubble wrap, as I sometimes joke, is not always the most person-centered way in which I would prefer to ensure that our agency and our programs are run. However, when you are in a pandemic in front of you, that is what you need to resort to, and ensure those health and safety pieces are put forth. But some quick lessons learned that is always, I think we all learn in these types of health emergencies, or just emergencies in general, is that I have continued to have a deep sense of appreciation and gratitude, I think, for not only our disability community, but our disability service industry and our families and individuals themselves. I have appreciated the frontline direct support professionals when they were having to go into so many unknowns, right? Some of you are maybe medical professionals, some of those essential workers. It is probably scary to think that, okay, everyone else is staying at home and I'm having to still show up to work and not knowing exactly what COVID-19 is. What does that mean? Can I get it? I don't have enough equipment. How do I do this with a lot of unknowns? So I give huge kudos to those frontline direct support professionals as well as providers working hard every day to maintain the needs of our individuals and to just maintain some normalcy and making sure they can continue to enjoy their lives. I definitely appreciated families. Many of them stepped up in ways that they haven't needed to in the past. They have, in some ways, even reconnected with loved ones that have utilized the service system, and some of them had taken their loved one home to really kind of provide the supports and maybe rethinking what does this look like in the future for them. I also appreciated just individuals that we happen to support. They adapted with grace. They had such a significant change in their life that we probably recognize there's many of individuals that we happen to support that don't necessarily, change is not the best thing for them in their life, and that much of a dramatic 180 is very difficult to their routine, to what needs. And I don't have the specific data, but we anecdotally noticed, incidents of some behavioral needs. In fact, we had a national call with national directors, and one particular state is actually trying to identify, as behavioral data or crisis and incident reports had gone down, is there any correlation with maybe the change in types of services, or maybe some more control, or maybe some of those remote supports? What was that? Was there any correlation that can be made? And then in general, this community stepped up. Community stepped up in helping fund PPE and equipment needs. They provided resources, some as making masks for our providers or for our individuals, as well as assisted with some of the technology needs. So it was a true kind of great learning and deep appreciation process for myself and our leadership team of recognizing that there was some true partnership that comes together in these times of crisis. I think a few pieces related to some silver linings, if you will, is one, probably telehealth was one of the most recognized wins. Now, I say that with also recognition that telehealth is not for everyone. We also recognize that there's some access issues in general for the state of Indiana to ensure that that is done well. But for our early intervention, our First Steps program, we heard anecdotally that parents were absolutely more empowered. They were more, early intervention is truly more of a coaching model. It should not be like therapists working with child by themselves. It really is more collectively, so that parents are learning how to adapt and coach their own children through that process. We also learned that individuals actually preferred some having their quarterly beads team meeting virtually. And in fact, they felt like they were able to be more direct and be more involved. And I guess if you sit back and think, man, let's say we have 5 people come into my home and just talk about Kylie and what all the things she's done and hasn't done and what her goals are and what they weren't. It may just feel better. You may just feel more comfortable to be involved more remotely or feel like you have more control. So there were some, again, anecdotal wins from that piece. I think just in general, the recognition of social isolation and need for connectivity. Social isolation is clearly not a new concept for our individuals with disabilities. But when it becomes a large issue, like a stay-at-home order, and the mental health awareness of what that does to people, I think in general, hopefully that will not be forgotten. And as we continue to evolve service delivery for people with disabilities, that this is something that they have actually had to live with their whole life in a lot of cases. And how do we continue to ensure that they have appropriate connectivity? And I personally think that some of the telehealth or remote options is, again, another creative solution for some of that social connectivity as well. And in general, I have tried to, as I know the public health emergency is not over, but in some ways it's kind of become, I know the new normal is overused, so I'm going to just say it, the new normal. I think we recognize that we have to, in some ways, reimagine these supports. And I say that not just the paid supports, I say that as a system, I say that is as a community and as a civil rights movement for people with disabilities, that I'm not sure going back to pre-COVID is necessarily the best thing. I think in some ways, I think of it as a snow globe for our system and for our people, that we had to shake it up. and things like telehealth that we've always been our mind, we've always talked about, we'd really like to pilot or not pilot. We actually just had to do it, right? There's things that maybe individuals thought, man, I don't want to be in this day service program, but I've done it for 10 years and bam, you can't go to day services. So it may give them that opportunity or that aha moment that says, okay, now that I can't go, these are some other things I want to do. I say that also recognizing that people absolutely want to go back to what they had before, but it shouldn't just be automatic. There truly needs to be a continued conversation of what's appropriate with the current service options that we have. And then as a system, how do we continue to adapt and make sure that individuals' lives are complete and that we, again, reimagine what they want and listen. I think during this process, we need to make sure we are attuned and listening to not only families, but listen to also the individuals and what their trajectory looks like for the future. I may stop and let Kim maybe say a few words too from her perspective, if you don't mind.
Well, first of all, thanks everyone for having us. As Kelly said, I am a fellow Fishers resident living over in the Villas of Saxony. So this would have been my prime opportunity if we were meeting face to face to not have to travel for a meeting, but that's okay. We'll do that sometime in the future. In terms of kind of those lessons learned, I think Kylie really hit on a lot. I think the ones that really stick out for me, and again, are ones that she's already mentioned, but just the kind of dedication and commitment of our direct support professionals. We saw staff make incredible personal sacrifices to make sure that the people they support continue to have a good life, even in a time of uncertainty. And so I think that's probably the most, I always, those are things we already knew, but I think this pandemic really highlighted and punctuated how critical those staff are in the lives of the folks that we support, and kind of the difference that they can make in someone's life. So I think that's probably first and foremost. I think in addition to that, and Kylie touched on this in a couple ways as well, but I think, as a system, and Kelly may have shared in some previous meetings, one of the things that we have really worked very hard on for the past almost 4 years now is really moving towards a culture of the life course framework. And that's really a holistic way of viewing people, so that we don't just think about people in the context of the paid services that they might receive from us, but we really think about who they are as a whole person. And what does their entire life look like? What are the things we may provide as a system, but what are the things they get, through family members and through friends and through coworkers and through their community? And how do all of those different things, just like they do in your life or my life, how do those things come together in support of an individual? And how do we help kind of facilitate those sorts of connections? And so I think this, one of the kind of underlying principles of that life course framework is that we start with people's strengths and assets. Every single one of us comes to the table with a set of strengths and assets as an individual and as a family, and how, as a service system, sometimes we don't honor that, to be real frank. We immediately start talking about what's wrong with you, and sometimes that's because the system kind of sets us up that way. But what I was really impressed with was really seeing the strengths and assets of the people we support shine during this time. Their level of resilience, their level of adaptability to the situation, their spirit of adventure, and some of the interesting things we've had to do, I think has really been pretty incredible. And I think those are the things that I'm really hopeful as a system that we don't lose sight of, and that we build kind of moving forward with those understandings and with those things in place. And then kind of closely tied to that was something Kylie mentioned, but because of that, and because we were able to put some supports in that really honored folks' strengths, I think we saw folks really take a new sense of ownership and direction over their own life. That some of the tools we use, like telemedicine, or simply not having the ability to fully rely sometimes on those paid supports, help folks to try new things, to explore different types of supports that they might be able to use in their life, and really kind of take charge in a way that, again, sometimes as a system we don't always readily allow for folks. So I think there was a lot of great learning in that. And again, things that I think we're really hopeful that we maintain as we think about moving forward through COVID and then some of the greater systems changes as a system that we're exploring. So. Kylie, I'll kick back to you.
Yeah, I don't know. I wanted to maybe mention, and some of you may, I don't know what Kelly has shared, and but I would just indicate that with respect to COVID data for the specifically IDD population, so because of our incident reporting requirements, we only got data for our Bureau of Developmental Disability Services. So this isn't for all programs, but it includes, as Kelly mentioned, the Family Support Waiver, the Community Integration Habilitation Waiver, and the SGL, or Supported Group Living or Group Homes. Sorry, I'm getting some feedback. I hope that's not overly annoying. So we have about 30,000 individuals that we serve in all of those programs. And as of Monday, we have 202 individuals that were tested positive for COVID-19, and we unfortunately had 11 COVID-related deaths with respect to our particular individuals with intellectual and developmental disabilities that are served in the BEAD system. So just for some context and understanding, that is the data that we currently have, a positive that we have seen in the last 2 weeks. We have seen a 62% decrease in the reporting of those cases. So again, positively, we are trending down, but continue to take the necessary precautions as maybe day services reopen, or how do we do in-person therapies for our early intervention program. So continuing to be cognizant of what those needs are as well moving forward. So. I think we kind of probably brushed on a few of those questions, but I'm absolutely open to having some questions or open discussion from all of you. I'm not sure what the time frame is. Kelly?
Did we lose Kelly? Somehow
Maybe.
I see her on the screen.
She might be on mute.
If anybody has a question, maybe we can, if you want to share on the chat, or I'm not sure, is Kelly back?
Yeah, looks like she might have just stepped away because her screen is dark. There she is. And she you're on mute.
I have a question. Am I muted? Okay. Just thought, let's put it out there. She's gone. So, I heard two different stories about respite and telehealth, because we're not getting any respite right now. It was initially, I thought initially it was respite as a telehealth service was a possibility, but then I heard otherwise. So I'm just kind of confused on that one.
Yeah, so I think there are provisions within our Appendix K, which is an emergency declaration, and provisions that we needed to put forth through our Family Support Waiver and CIH waiver. And Kelly, I'm happy to send, well, you could, or I'll resend the guidance that BEADS has regarding both of those flexibilities. I think at this point, is it Marie, right? Who's
Mary, yes, yeah.
Mary, I'm sorry. I think it is important to really kind of start figuring out what does that look like as we kind of continue on in reopening, and we are, following, fingers crossed, moving forward with the governor's kind of plan to get out of the stay-at-home order. I think we need to revisit, probably from an individual case, how we can necessarily get the right support needed. While some providers are, first of all, providers are all considered essential services. So they are permitted to continue on providing those services. What we ask from the state is to make sure that there's a conversation, that family's comfortable, that provider's comfortable, that we all kind of agree that, you know, if masks are needed to be worn or how is that service going to be delivered, that there is those kind of open communications. With respect to those remote services, I think those can continue to be on the table, but just need to have a continued individual discussion of what makes the most sense as we continue also reopening. Kim, anything to add?
Sorry, had to unmute myself. Yeah. No, I think you're absolutely on target. I think those things have been available. Or are available, but yes, should be kind of something that the team talks through to really understand, could the person benefit from telemedicine? We did put some provisions in there along the lines of that the person has to be responsive to verbal redirection or verbal direction, you know, that sort of thing. Obviously, as Kylie mentioned earlier, telemedicine is not necessarily for everyone, but we wanted to make it an option as far as we could, and not for every service. There are some services like case management that might be a little easier to deliver via telemedicine versus a service like respite that might be a little more complicated because there's sometimes a hands-on component to that service. So I would say your team should absolutely be working with you to kind of work through that and determine if there's a need. The other thing that I would mention is, and I'm sure none of you find this surprising, but particularly through the month of March and April, we cranked out a ton of updates and guidance and flexibilities and options and all sorts of things. And sometimes even for us to stay on top of all of that was a struggle. So I know our providers who were dealing with a lot of really important issues, like how to keep folks safe on a day-to-day basis and keep staff coming into the settings and all that kind of stuff. Sometimes some pieces and parts might have gotten lost in the translation or in the communication. So I've done a couple things. I just threw a link into our DDRS COVID resource page. So that has all of the guidance that we have posted around COVID for all of our programs within DDRS. So that includes the waiver programs, but also includes first steps and vocational rehabilitation. So if you're interested, you'll see that. In particular, I point you to a couple items on that page. One is we put together a resource toolkit around COVID-specific resources, and it's organized by what we call life domains, but that's kind of a concept within the life course. So really looking at kind of 6 different aspects of a person's life. So their daily life and employment, their social and spiritual life, the way that they make decisions, health and wellness, safety and security, and I'm forgetting the 6th one, but regardless, there's a variety of resources available for families and self-advocates to take a look at and see if there are some things that might be helpful for them. And that's going to be towards the top of that page. We also have some webinars that we did specifically for families that are recorded and available on that page. So if you've not been there to check those out, definitely do so. And then in just a second, I'm going to post the specific guidance that Kylie was referencing. It's a fairly lengthy document, but you can use the table of contents to kind of navigate around it so you don't have to read all of the pages. And then, Stacy, when I was in there doing that, I saw your question about telemedicine. Is it less expensive to use? And currently, no, it is not. The way that we were able to, the flexibilities that the Centers for Medicaid and Medicare Service allowed states to use around telemedicine allowed us to just, we pay the same service rate that we would have been delivering the service face-to-face at this time. Now, if we look at doing this on the long term, there's lots of additional questions we'll have to figure out, and I don't know that we can make that commitment, you know, from a long-term perspective, but at least right now it's the same price, so to speak.
Hey, whoever has the lovely birds serenading us, if you could mute your microphone, that would be awesome. Mary, I wanted to follow up a little bit in addition to what Kylie and Kim suggested about the Appendix K flexibilities. From a provider perspective, there were several providers. We knew that the Appendix K flexibilities that we had applied as a state to the federal government, but it had to be approved. And that took a little bit longer than a lot of people expected. So some of those flexibilities have really more recently been available, and a lot of providers were not allowing those flexibilities earlier in the pandemic. So in addition to asking those questions about how does this really work at the individual level, and does it make sense for them, it is a new conversation for some teams to start having now as we move forward and re-entry into service delivery. Any other questions for Kylie and Kim? You guys are the best. This might be the first time I've ever asked you both to do something and you both said yes.
It worked out.
No, I really, really appreciate it so much.
Yeah. Well,
We are
appreciate
going to
all of you, and thanks for the questions.
Yep, thank you. We are going to circle back to some of the COVID-19 data amongst folks in the state a little bit later, but unless we have other questions for Kim and Kylie, I'm getting feedback too. We're going to let them go. So thank you guys so much again, and have a great night.
Thank you.
Thank you. Take care.
Ross, you can go to the next slide. So some exciting information in the questions that people are pretty curious about. What are the next steps for the affordable housing development in Fishers? As many of you know, Real America was awarded the opportunity to do South Point Village Apartments here in Fishers. It will be located on Lantern Road, really just south of the Speedway gas station, as Lantern Road curves to run along 69, that triangular piece of property. They closed and on their financing and broke ground last week. The plan is to complete the construction by September 2021. And just to give you guys some idea of what that's going to look like, it will be a 4-story building. It will house 62 units, 1 and 2 bedrooms. What Ross is showing you now is the renderings of what the building will look like. There will be 13 units that are set aside as it's called community integration units, and that is specifically fully ADA accessible units for folks with disabilities in the community of Fishers to have the opportunity to live in a fully accessible ADA unit. It is such a great thing for this community. I want to give a special shout out to Wilbur, who I know is on this call, who has been great at we were asked as members of the Fishers community to give them input and talk to the architects specifically about what we suggested. We know Wilbur's had a great deal of experience with that. So it was fun to see them come up with some great ideas on how to move forward from an architectural point of view. In addition, there'll be 49 units that are set aside for workforce housing. And so folks can work in Fishers and have affordable housing to be here as an employee in our community. Here's the kicker, and this is on the slide. If you are interested in being a potential resident, or you know someone that you want to be talking about potential residency at South Point Village, you are going to call 317-815-5929 and ask for Anna Rankin. They are taking a list now of people who are interested in living in that community. One of the questions that came through our Q&A was, what does affordable housing mean? What they suspect is that they'll be able to rent to individuals who earn less than 60% of whatever our median community income is. And so what they believe is that if you have an average income of $27,700 up to $41,700, if you fall in that range of income, that you could potentially qualify to live in affordable housing. And again, the 2 primary reasons for those units will be, 1, to help people with disabilities to be more independent and to live as meaningful participants in their community here at Fishers, and 2, to help people who want to work in our community have an opportunity to live here as well, even if they are in a lower than median income. Some of you have also asked about specific homes or living arrangements for people with intellectual disabilities. And some of you are familiar with, don't get too excited, Ross, because I'm making this up as I go along. You can just leave it right there. I just want to add to this, the villages of Merici, which many of you know of, they currently have, I believe, they're over by the fort, and they have 26 units. And what it allows for folks with intellectual disabilities to live in a community of people who choose to live in a community with folks who also have intellectual disabilities, and they are able to have their staff come in and provide services. And it's a community that does really cool things, like they have their own dances, and they have yoga, and they have lots of really cool social activities. But it's not just for people that live there. It invites other people from the community in, and people from that may be supported by various agencies. So people that live in that community can bring their friends to yoga class or whatever. It's a really cool group of people. They were just awarded a partnership with Merchants Affordable Housing, also through the Housing Authority at the state level, to build a new community that will have 40 units, and it will be in Carmel. And I just got these details today, so I'm trying to read my own writing. But basically, they're planning to break ground in July, and they're hoping for it to be completed in late 2021 as well. So they're a little bit further behind. They haven't broken ground yet, but that's going to be more of a community of people that are receiving services. And I know that is something that will be quite appealing to folks who may be or may have young adults living at home who are going to be to that point where they're ready to live somewhere outside of the family home. And that community will be a very walkable community, and it will be in close to downtown Carmel. Okay, now you can go to the next slide, Ross. There we go. So,
Kelly, quick, I'm sorry, Kelly, before
go ahead.
we move on to the next topic, just a quick question, and also, well, first of all, a shout out again to the housing committee. We have a housing subcommittee that is a part of the overall Fishers Advisory Committee on Disability, and it is headed up by Wilbur Sutton. And I know M.E. Barwitz has also been very involved in that, and a few others that are involved in that subcommittee. But, you know, it's through this effort of us coming together and working with our planning and zoning department in Fishers, our community partners, the providers that are in our area, we were able to really get this up and going. And I just want to thank everybody that was a part of this, that is involved. And I urge everybody to reach out to us, Kelly and I, about initiatives or subcommittees that you might be interested in getting involved with, because this is our efforts, and this was something that we all worked really hard to do, and I appreciate everybody that helped with that. One quick question, Kelly, though, the services, are there going to be services for the people, direct support services for the individuals living in the building?
Yes. So the interesting thing is, it is a housing community, but you're not tied to Villages of Merici being your service provider. You could go in there, and Opportunities for Positive Growth could be your provider, or Insights Consulting, or Janus, whoever you choose as a provider, could come into your apartment. Think about it as a 55 and older community. Those folks choose to share social experiences together because of the commonality of their age. It is very similar. There's a lot of social activities. There's an apartment community for like-minded people, but if they need in-home services, they can bring their own provider. And I know you guys are wanting some information. I promise in the notes, before we send out notes, we'll make sure that you have information about Village of Merici. In fact, maybe at a future meeting, I would be happy to have Colleen come, the executive director of that agency. She's fantastic, to talk a little bit more about what they're doing. And I think you guys would really enjoy that a lot. Any other questions about affordable housing before we move on to a little bit more about COVID-19?
I'm just going to jump in with one comment. I stuck a note on there. We'd still like to see something more affordable, accessible, and home ownership. And I talked with the mayor, and he is open to us putting multiple units, like duplexes, quadplexes, something like that. If we find the land and the builder and the people to do it, he's open to try to get that passed through city planning. So I just wanted to share that.
That's great. Stacy asked if there was going to be a press release on the new community. There has been some news stories provided if you're talking about the new South Point Village. Unfortunately, because of COVID, they weren't able to have a big public groundbreaking. I'm sure that they'll be excited to have a ribbon cutting when they get to that point, and hopefully we've got some of this past us. But certainly I will get you guys some more information about both of those initiatives and put that in the notes for today's meeting. I'm going to move on to the COVID-19 data. Kylie suggested, she gave some of these numbers. And for those of you who have someone with a developmental disability that lives in your home, or you have an adult or teen, school-age child, whatever it is, trust me when I tell you, this is not to scare you, but sometimes what we all hear as information, whether you're listening to the news or you're trying to get it from a website or the State Department of Health or your community Department of Health, it is not necessarily honing in specifically on our population. And so I feel like it's important for us to understand this, because as we get to Sunday and Monday as a state next week, all of a sudden face masks become optional instead of recommended, because we're about to go into phase 4. And what you'll see is that what we have learned is that some studies show that folks with intellectual and developmental disabilities are as much as 5 times more likely to contract COVID-19 and as high as 5 times more likely to die from COVID-19. And that's because and Dr. Lane talked a little bit about this, pre-existing medical conditions. We have what kind of homes they may live in, frequency of staff that come in and out. Some services can't be delivered with social distancing. Some of our folks have a lot of difficulty wanting to wear PPE or understanding social distancing compliance. And so these are some things that we have to keep in mind. Ross, you can go to the next slide. So this is a difficult slide to see. And as Kylie said, the great news is we've had a significant decrease from even just a month ago in the number of new cases amongst folks in Indiana with intellectual disabilities. But what you can see here is the prevalence amongst the general population in comparison to the dark orange line is the prevalence in Indiana amongst folks who are in BDDS services. And it is significantly higher. And so we just have to be super aware of what it is that we can continue to do to mitigate risk. And while everybody's all excited to go back to restaurants and the grocery and get those kinds of things going, I think that there's some things that we still need to be really careful about. Ross, you can go to the next slide. So here's the Back on Track Indiana plan. I think I look at this about 10 times a week from the governor's office. And what you will see is this weekend, I guess it's June 13th and 14th. So there you have it, Saturday and Sunday, folks. As a state, besides the 3 hotspot counties, including Marion, we are all moving to stage 4, which pretty much puts everything at, the only really restriction is restaurants will just go to 75%. Bars and clubs will be open for the first time at 50% occupancy. And we move in the face masks, facial coverings from recommended for all people to optional. There are ramifications for that. And so I would just suggest that just because the rest of the world is able to do something, you still have to really make decisions that are best for you and your family and your situation. Next slide. My favorite thing that Governor Holcomb has said in any press conference that he did when he was doing these every day, and I was watching him because to be honest, as someone who is in leadership in healthcare for our folks, I was really, really scared in the beginning of this of how to keep people safe and healthy and protect our staff. And he said, just because we say you can doesn't mean you should. And I think that's something we should all keep in mind, that just because everybody else is doing it, I can hear my mother's voice in my head. Just because everybody else is doing it doesn't mean you should be doing it. So you really have to, you can go to the next slide. In consideration of how you are going to reentry, whether it's your entire family unit, your loved ones, other people that you socialize with, understand that you absolutely have to make the decision that's good for you. And there's some things that we're experiencing across the state of Indiana when it comes to reentering people into services, and that would be having staff in your home, or providing going to day programming, or even going to center-based ABA programs. Is that I would highly suggest that, and you should absolutely do this if you haven't already seen it, ask the agencies that you work with for their COVID-19 plan. The governor's office has said to all agencies, as you reopen, you have to have a return to work plan. All of the agencies that provide services to our loved ones and our clients and folks, and to you guys, really, they should have a plan in place. Being aware of that will help you, and many agencies are open to being further informed. I think every one of us has heard 52 ways to Sunday of how to cover your face and how to be socially distant. But when it comes down to re-entry into the community and into services, it's important to know what the agencies supporting you have in mind. Please be patient. I know people really want services back. They really want their staff back. They really want to go back to ABA. They want to go back to day programming. Organizations are trying really, really hard to mitigate risk given the increased incidence amongst our population, and trying to control infection amongst our workforce and the folks that we support is really a #1 priority. We all want to get back at it, but we need to do so safely. I will say that most agencies, in fact, I haven't heard anything different, even beyond this weekend, most agencies are requiring their staff to wear face masks while working in the homes, whether it's a group home or waiver services, respite, PAC, all of those things, and encouraging clients to do the same while in the community. You may have experienced many behavioral consultants, music therapists, and rec therapists, and ABA providers are continuing to encourage telehealth visits if that's appropriate and if that's working. I have seen several behavioral consultants and music therapists doing driveway sessions as opposed to going into the home, because that provides more risk. When I'm taking all of my germs into a home, I can give you an example. Our behavioral consultants are only allowed to go to one client home a day. You're not allowed to go from home to home to home. These are things that we're really working with, which is why it's really good for us to continue telehealth when we can for the short term, so that we can get past this period of reentry and spreading a lot of germs, and continue to try and mitigate the risk. And I'll just give you a heads up. Certainly you have the right to refuse to do this, but there are agencies that are asking clients and guardians just to sign a release or consent to provide face-to-face services back in the home, understanding that there are risks both for workforce and the individual receiving services. Just putting that in writing between the two parties is really helpful. Ross, you can go to the next slide. DAVE programs, for those of you who are itching to get back to Janus or OPG, community services, or outside the box, or wherever it is that you might go. Again, they're beginning to open in phases. Most folks are opening with an expectation of PPE and social distancing. Some are offering a hybrid of in-person services, and then some other people will join those classes virtually for those who are not quite ready to get back into the building with a whole bunch of people. So if you are missing your day program and you're wanting to get back there, I would encourage you to reach out to them and find out what the plan is for reentry. Statewide, there are lots of plans for people beginning in phases to get back to business. And then this is the same page that Kim had shared with you guys, but there are so many resources, including guidance in different languages, visual communications for deaf and hard of hearing, visual aids to use with folks who are having trouble understanding, both in home, at home, and in the community. So I would encourage you to use that website as well. Russ? I found a really interesting article, because I think one of the things that Dr. Lane said that rings true on something we need to think about. This is a novel coronavirus. That means we're still learning about it. We're still understanding how it's impacting people, how it is spread, and really understanding on a day-to-day basis things that we haven't understood for the last, several months. I swear to God, it feels like a year we've been doing this. But the interesting thing, and she alluded to this, is that research is supporting that to effectively address the spread requires that all 4 things work together. For those of us that are near and dear to working with folks with complex healthcare issues or who are dependent on others for supports, we have to remember that just washing your hands isn't going to get it, and just social distancing isn't going to get it. We have to assure that our staff are staying home if they're sick, that you are canceling staff if someone in your home is sick, that you are doing social distancing, that we're doing hand washing and hygiene, and that we're wearing face masks. All 4 of those things really work together. And there's a number of studies that show, for example, there's been a lot of outbreaks with nursing homes. The nursing homes that had staff wearing masks and not the people who live there wearing masks in the beginning had higher rates of outbreak of COVID-19 than those nursing homes that said everybody's got to wear masks. If you're out of your room, you got to wear a mask. 6 feet is a good distance, and it seems safe. But the truth of the matter is that some people who have really hardy coughs or are screaming or coughing can spray aerosol 9 to 15 feet away. So that's why it's important to wear masks, because social distancing at 6 feet is great, but it's not always enough to protect you. So I would just keep in mind, this is something I think is really good as a point of conversation with staff who are coming back into your homes, who are working with people that we love, who are working with you guys, working with your families, understanding that all 4 of these things really, really need to go together for us to continue to avoid the spread of COVID-19. Does anybody have questions about COVID reentry specifically? You can type it in your chat box. We talked about affordable housing, which were some of the questions for the Q&A. Ross, you can go to the next slide. One of the things that someone asked, and I think it's a good time for all of us to share with each other what our thoughts are we going to continue with the same committees as our group moves forward? Are there any communities that need to be added, or any committees that need to be added, or any that we feel like they've fulfilled their purpose? Cecilia, you would be the one that can take over this conversation. How are you feeling about the committees as they exist as subparts of our bigger community?
Right. I think keeping what we have, and like, for instance, with housing, we still have housing initiatives that I think are important to look at, and home ownership and affordable home ownership by people with physical and intellectual disabilities, a group community setting like a village of Merici where there'd be wraparound services, something like that. People have been asking me. If Marie Kennedy is on the line, I don't know are you still there, Marie?
I am. Mm-hmm.
Okay. Why don't you share a little bit about a new committee you shared with me today? Because this one, given especially with COVID, and I think it's something that is a new committee we could start implementing or looking at. So, Marie, why don't you go ahead and share your thoughts on this?
So yeah, you and I were talking today earlier. It's kind of timely that we're having this meeting, but something that I wanted to start and just looks like there's a need as a community-based like social network post high school, so that the individuals as they leave high school and that whole social where all those great social opportunities are in place, that just goes away. And so you and I were talking today about potentially doing something with perhaps the Parks Department where there's some social opportunities, a club kind of thing where maybe we network with in the community through churches and the YMCA to do some sort of an inclusive social kind of just opportunities on a regular basis. So it's, certainly, as you can hear me just sort of talking about this, it's certainly something that is, nothing rock solid, but I think that the need is there when I think Angela's on this call. I've been on some calls for GGs, and the thing that some of the programs that they have for some of the adults, what it provides is a really great social opportunities for these young adults. And so it's such a need. And I think that, to carry on what we've been doing, I think this is the next thing that I think we could do that would have a really positive impact.
Right. And one of the things that I shared is, like, for instance, Fishers, we have the Firebirds, the Fishers Firebirds. It's a 50+ group club, if you will. So, putting something like that together where there would be like set events throughout the year that young people and young adults and their families could get together, because there's so much isolation, and the caregivers, the parents also want to meet other parents, and they need to drive sometimes most of their young adults to events and things. So I want to try to have that conversation with maybe some of our Parks and Recreation director, Ross, Hillary, Kelly, and some other people. If you're interested in exploring this new committee, if you will, please reach out to me, and we're going to look at seeing if we could have a meeting to kind of further explore this.
Cecilia, I think this piggybacks on what we just heard about those 6 different focuses that Kylie and Kim talked about, and where they were saying we're looking at the whole person. And if we broke down maybe, as we had my point of view day the last time, we had the biggest table was those who were looking at a daily life of a person with a disability, if you recall. And if we took that category alone and maybe broke it down to looking specifically at these 6 areas in the whole person, maybe that makes sense to break down that committee alone that we had at my point of view day. And this particular thing being one of those very elements. Hey, what kind of socialization is out there? So not only my medical, my schooling, whatever that makes up the day of a person with disabilities, but the fun as well. So I kind of see this being a subcommittee of that element of my point of view, whatever we call that. I wanted to say quality of life is what we called it. So that was a table that we had, a section. So that's
And I'm going to include this also in the notes. I think if you guys had a really brief introduction to the life course framework, which is the whole cultural framework that the division is using to integrate at every level in every service. And it talks about those 6 life areas. And the cool thing is this is not a framework that's about people with disabilities or a framework about people with autism or on the autism spectrum. It's about people, period. It's about me and you and people in your life. And when we start thinking about what's available to the all, that is when you start realizing what is it that we have to do to help people have a better opportunity to live their best life. What's missing in our community in those 6 areas that don't allow all people to have the same kinds of opportunities. And so I think the life course framework would be something great for all of us to look at. And I'm happy to share that information as well.
I think that helps us in this definition of what committees need to come next. And I think we've struck on in this very conversation that happened today with Cecilia and I believe it was Mary. I think we haven't hit a lot on that, and we could. It really is a committee that already exists, but as we saw in my point of view day, it's huge. It's huge because it's the whole life, it's the whole day. And if those 6 elements are the way that perhaps we look at the whole person and we form subcommittees and we have these people focus specifically on, hey, what can we do to have fun? I think this is perfect, and I'm really proud of everybody for coming forward with this idea.
That's great. And pardon me, it's free birds, not firebirds. It's the 50 plus and over the club in Fishers. So I'm looking here where it looks like our community outreach director Gerard Franklin is saying, Marie, let's talk, let's get together. So already there's some great, I think, people wanting to get together and brainstorm. So we'll get a meeting together and kind of talk through that and see what we can do. I think that would be awesome.
Great. The last question that came through the SurveyMonkey that I just want to touch on is someone had asked about, for folks in our community who are really still feeling pretty vulnerable and wanting to access city services and would like to learn more about businesses in our community that are specifically trying to accommodate folks. I'm surprised you couldn't find it because I'm not surprised you couldn't find it because I couldn't find it either. But it was shared with me by the city, with Cecilia and I, that if you go to the city services tab on the Fishers website, and then you look at the left column and go to the health department, get to the COVID-19 page and go to frequently asked questions. The frequently asked questions within the COVID-19, there are some links to specific ways that our community is making accommodations for people who need to get out there. And in addition to that, there is a COVID-19 hotline. If someone is wanting to access city services and they would like assistance in doing so in a safer way where they are not feeling so vulnerable, and they want to practice social distancing and all that stuff, all you got to do is call the hotline, which is 317-595-5211, and let those people know that you'd like some help accessing city services during this time, and they will make those accommodations for you personally. So I wanted to share that information. I think that we have covered all of the questions that you guys put out there ahead of time. Does anybody have questions? I think we have lots of great ideas for whatever our next meeting would be, whether that is virtually or together in the same room. Certainly, if you guys feel like you'd like to know more about the life course framework, I think it'd be great to engage Kylie and Kim as division leaders for the state to participate in my point of view day or the breakfast with the mayor when we get to that in March, because I think that they're excited about what's happening in our community and they're engaged and would like to participate. We just have to find what's the best use of their time. Olivia.
Yes. Hi. Hi, Kelly. Hi,
Tell
everybody.
me your question.
That was actually my question, but it was a little, perhaps didn't word it correctly. I guess I could speak by my own experience. So I have issues with being immune compromised. And so what I was wondering if there was some type of, where the businesses in our Fishers, if there was a way they could identify as far as, some of these places have certain days that they have hours where folks, the elderly, those that, that have underlying medical conditions could shop. Knowing, for example, I show up somewhere and nobody's wearing a mask, and even though I have a mask, I have to leave because I'm concerned. I'm concerned about shopping there, running my errand because I have the possibility because I am immune compromised. I was just wondering if there's a way to get these businesses together to kind of like have a spot where people could look up and say, yes, we do wear masks here, or there's a certain time we offer to people to shop. So that way, when you leave the home, you don't feel anxious showing up somewhere and having to walk out, not getting your things done.
I do know, and I'm assuming, I don't like to assume, but I know that Kroger still has hours, certain days of the week in the first hour of the morning where they allow people who are at higher risk to come grocery shopping, which I think is great. And I do know that there is some information about that. I think the hard thing, and that's why I talked about the, let's get back at it, Indiana plan that the governor has. That's for the whole, and that whole, those rules for everybody don't necessarily fit for each of us as individuals. And so I don't know that we're going to see guidance differently until we run into a wall where we have more spread.
Okay.
It's certainly something I know Cecilia and I are willing to. How about the city council, Cecilia? I'm going to challenge you to talk about that with the council since you're president.
Well, I think.
How do we continue to encourage people in our community to be aware of the vulnerabilities?
Sure. And maybe we can follow up with Dr. Lane about that. And just, I know that since the COVID crisis happened, our city has been very engaged with the business community, and maybe that's something to just share with if the calls are still being done. I don't know, Ross, if those calls are still being done like on a weekly basis, but maybe that's something that could be shared to the businesses to see, would they be willing to provide some kind of special hours or times for some of the most vulnerable in our city.
And this is what I'm finding too. I'm totally on board with what Olivia says. And I posted a picture of me in a mask and a story about me going into Target. Mom might wear a mask, but the kids aren't. And then other people aren't wearing them. I had more than I could even imagine saying, well, you're the one immune compromised, so you keep your mask on, but we don't have to do this. You protect yourself, but now we're okay. We're not going to harm you. Just keep your social distance. And I absolutely was furious with the comments like that, okay, those of us with disabilities, those of us who are immune compromised, you go be responsible for all this, and the rest of us are just going to go on with life. And I think that is something I would like to share. I'm sure Olivia feels it when we go into stores. We're the ones stared at now because, why do you still have a mask on? We're now opening up the public. No, everybody should still have masks on. Everybody should social distance. That didn't happen in Target at all either. And then I'm looking at the kids. And the kids, none of them, mom and dad had a mask on, but kids didn't. So I think there's still a lot to be done here in Fishers to make sure that we're still following what is recommended, rather than, hey, the doors are open, you go take care of yourself. It was really rude, and I could share what those folks said on my site, but I'm like, I was furious. So
I went to the post office, just to post office to mail package, and the postal workers were not wearing masks at all. And this was about a month ago. So that kind of thing. It's just, it's just something that folks that, don't have to go through it, don't really understand or get. So I guess it's a little bit about, like we talked about before, invisible disabilities. People don't see it. It's that type of idea of, kind of attitude.
But putting it all on us, well, you go stay home, you go, I have things I have to do too as a single mom, but you go manage it. You go away and sit in your house and isolate, and we get to go have fun out here. Well, that doesn't, that's not the case. So I think just reinforcing that we're not through this yet. We do expect another wave of it in the fall when flu season comes, and people are just not understanding this is not over yet. So if we can do that to our businesses and say, this is going to be the norm in Fishers for a very long time. And those who tell me on my site, oh, you're taking my rights away. No, I'm not. No, we aren't. We're being smart overall. So there's a reason that Fishers has had those low numbers that Dr. Lane talked about. We did a good job of this. I think the message has to be to the council, to the businesses in the community and surrounding, and to the people that we aren't done. We're going to be best in the city of Fishers for the long haul. That would be my, I made my speech now, off my soapbox.
Amen.
So I think that there's some great thoughts in that to how we can look at some pro-mask type communication, and can probably slice and dice our community to find ways to really speak that. And Cecilia, I'm going to make
We'll have some conversations and feedback to provide to our business liaison and also Dr. Lane to see, what we can do with helping those in our community that might need that that time to be able to do things, in a safer way. So I will share that input. Two things before we leave, that if any of you are need any kind of support whatsoever, I know it's been hard because we can't, see each other face to face. Kelly and I are here. There's others on our committee. We're a community of people, and I want to make sure no one feels like they are alone or aren't able to do things. So if you need help getting to run an errand or you need something, please reach out, and we are all here to help each other and help each other with resources, with ways we can support and help each other. So please reach out to us and we'll help you. I don't want anyone to feel they're alone or aren't able to go get a resource or something. So one other thing too is our next scheduled meeting for the Fishers Advisory Committee on Disability quarterly meeting will be Tuesday, September 15th, 5:30 to 7:30. God willing, I don't know, maybe we'll meet in person, but we won't know for sure. But if you want to save the date, and we will certainly, hopefully be meeting in one way or another. And we'll get out some agenda items out to you and all that.
And I know that some people are getting really antsy about what does school look like, and that's obviously happening sooner than our next meeting. If you guys are feeling like we need to hop on a quick Zoom call and just reiterate whatever guidelines we're going to have in place for the return to school in the fall, which I believe they start August 6th, just shoot Cecilia and I a message, and we can certainly arrange for that to happen between now and our next meeting.
Cecilia, what was the date one more time for the next meeting?
Tuesday, September 15th.
Yes, Tuesday, September 15th.
Well, thank you guys for giving us a part of your evening. It was good to see people's faces. Sometimes I get really super tired of Zoom calls, but then I get excited when I get to see people like you that I haven't seen for a while. So certainly, like Cecilia said, shoot us an email if there's something we can do to support you or if you have further needs. But as far as I'm concerned, I think we're good to go. I call this meeting adjourned.
All right. Thank you, everyone.
We did pretty good for virtual, I thought.
Have a great night. Thanks, Ross, for the tech support there.
Thanks, Ross.
All right. Take care, everybody. Bye-bye.
Bye, guys.
Hey, Ross.